Guys, so I just wanted to give a little overview of myself. Like I mentioned, I'm 31. I'm a college grad. I graduated from the best HBCU in Florida, in the nation. Forget Florida. I strike. I work in the healthcare field. I have 2 siblings. I have great friends, family. So I just wanted to give like a little overview of what my life has been like over the last 2 years. Approximately 3 years ago in 2014, the end of 2014, I was diagnosed with breast cancer. So like while I was transitioning from moving back home from Tallahassee, and I had been living home for a few months, and then I started to notice that I had a lump under my arm, and after a series of tests, it was confirmed that I had breast cancer. I did have a family history of breast cancer, but I just never thought that, this would be something that would happen to me. I don't know, it was never like talked about. I knew my grandmother had breast cancer. I knew that she died from like complications of the breast cancer, but I just never thought to even be worried about being checked or anything. But thank God I did find the lump on my own, and it was considered what they call early stage. It was stage 2 and a very aggressive form of breast cancer. So I did the treatments. So I was diagnosed at 28, which is fairly young, and it kind of like changed my world. I became a more outspoken person, and as I started to share my journey, I had so many people reach out to me, so many supporters, and just by sharing my story, I realized that, young women don't necessarily talk about when they get breast cancer. When you think of breast cancer, you think of older women, and before I started getting involved in the community, I just never realized that so many young women are affected by the disease. So like I said, I did the treatments. I had chemo. I went through the whole losing of the hair. So this is the second time that I'm bald bae, as my friends would say. So I went through the hair loss and the chemo. I underwent a bilateral mastectomy to remove both breasts, and I also had radiation. And so after that, I finished the treatments maybe like the end of 2015. Initially, I was diagnosed as a triple negative, which means that my cancer was not driven, or so they say, or thought that it was not driven by hormones. But later, after I had my surgery and they restained the tissue and did what needed to be done, it was found out that I was 30% estrogen positive, which means my breast cancer was driven by hormones that contributes to the things that we eat. I've never been on birth control or anything like that, but that also alternates your hormones, but that wasn't the case for me. I don't have any genetic factors that will make me more prone to breast cancer. Just think that the family history and what we eat contributes to a lot of diseases that we have, but neither here or there. So I completed that treatment, and up until a few months ago, I have been doing fine. Like being estrogen positive, or estrogen being a factor that grows or helps stimulate my breast cancer. I was placed on hormone therapy. So I'll take a pill and an injection every month, and also an injection every 6 months. And on my routine visit with my breast oncologist in July, early July, my labs were abnormal, so they did additional testing and repeat labs, and she explained to me that I was anemic, or the labs appeared that I was anemic, and that she was going to refer me to a hematologist. So a hematologist is different from a breast cancer, a breast oncologist. Breast oncologist focuses on your breast, and the hematologist focus on blood disorders. So my red blood cells seemed to be abnormal, and my platelet count was very low, meaning that I could easily bleed out, or if I fell, I can really harm myself. And so I was referred to the hematologist. The hematologist, repeated the labs and did protocol, and he said that we needed to have a diagnosis. He could see that I was anemic, but we needed to dig further. So I did my first bone marrow biopsy, and July 31st, that confirmed that I had acute myeloid leukemia. So I was a bit distraught because I just thought that I had put a lot of things behind me, and I just didn't think that I would have to deal with something like this so soon after being diagnosed with breast cancer, only 2 years out from my breast cancer diagnosis. Just to give you a little more explanation, is not considered a metastasis. So I know sometimes you see people, they speak about their stage 4 diagnosis and them having a reoccurrence of their breast cancer. So it's confirmed that I don't have any breast cancer cells in my bone marrow, but I do have leukemia. And I mean, it's like a whole lot of information, things that I'm still trying to familiarize myself with, but I'm willing to share my journey. I've been very open about my journey from the beginning, so I just figured that it's, I can open up and just have these videos here so that people are aware, and maybe this can help someone in the long run, because what they don't really tell you is that the leukemia as a secondary, it's called AML, as a secondary to previous treatment, it's caused by the treatments that I received for the breast cancer. They tell you that, but it's like a very low percentage that it will happen to you. And it just so happened that my cells mutated or did whatever, and I was diagnosed with the leukemia. So I'm a little late in starting on documenting the process. So right now I'm in the hospital for my second admission. After I was diagnosed, immediately the hematologist wanted me to start treatment. So I got the diagnosis on a Monday, and he wanted me to go into the hospital right away, but I mean, I just had to digest it. I had to tell my family and friends, let them know what's going on with me. So I did admit into the hospital the following day. So I did go to the hospital the following day, and I started treatment. So I started treatment maybe August 3rd, and it's a whole new ball game. So I got rid of my port after I did my reconstruction with my breast cancer, so I had to get a new double lumen. I'll show you guys here. It's very different from what the port looks like, because the port is like implanted inside versus the double lumen. It's kind of like a catheter, and so it's inserted through your jugular vein. I'm actually connected now. I just finished my first round of chemo treatment, first day or first session for the day. But it's a double lumen. It's connected to the jugular, so I had to have like a minor procedure to get it placed back in or whatever. So I was admitted August the 1st, and I stayed in the hospital for like 35 days. So with the leukemia, they do it's like a 2-phase process, possibly 3 phases. And so the first phase is called an induction chemo. It's very standardized. You get treatment for 7 days. 7 days, 24 hours a day. You're hooked up to the machine. It's like around the clock for 24 hours for 7 days. And after I completed the treatment, I did fairly well. I lost my hair again, and I had a loss of appetite, and then I ran a very high fever. So basically they monitor you because the goal is to clear your bone marrow and clear it of the leukemia cells. So the first treatment phase was successful, and they did a repeat bone marrow biopsy in which it showed no active leukemia cells, so which is a good thing. But they still monitor you. I had to get my fever down, and eventually I was released from the hospital after like 35 days. It's very, very different from the breast cancer diagnosis and getting treatment, for me at least, because I did mine as an outpatient. So I would go in once every 3 weeks to get treatment, and then I was able to go home. I was able to work and move around a lot. But with this, it's so much different. I had to be in the hospital, like the whole 30 days, 35 days with no break. And my immune system was very, very, very low. So like when people come to visit, they had to wear a mask, and it's like a whole nother ball game. So after I was released, I was able to go home, get a break, spend time with my family and my friends outside of the hospital, which was great because it's like you are consumed in the hospital. So right now I'm on my second admission. So this is called the consolidation process, and basically what the doctors try to do is to keep you in remission. So they give you a higher dosage of the medication, one of the medications that I received. So the induction process, I was on 2 meds, and for the consolidation, it's only 1 med, and it's run every other day for every 12 hours. So I get it like 2 doses a day, and the doses last up to 4 hours. So I'm getting it twice a day. So this is the start of the consolidation process, and as long as I am waiting on a transplant donor for the bone marrow transplant, I'll have to get these consolidation treatments. The max that you can get is 4. So this is the first one. I did have a repeat bone marrow biopsy, and I met with my hematologist today, oncologist, and he let me know that there appeared to be some cells that were in the marrow this time, but it's not confirmed if they are leukemia cells. However, if they are, we'll continue to treat as planned, and still do the consolidations. Like I said, you can have up to 4. I just wanted you guys to go along this journey with me, because most people see me post and you really don't know what's going on. It's only so much that you can write on Facebook, social media, Instagram. So I figured I will go ahead and record at least some of the things. I really wanted you guys to see the transplant process, because it's very interesting and very intriguing and very long, drawn out process. And it's just, we don't know these things unless you, like I said, you have someone that you're very close with. So I'll try to record day in and day out the treatment plans, and so hopefully we'll have the 3rd bone marrow biopsy probably by tomorrow or the end of the week, or by Monday, I guess. I just had it done the day before yesterday. So as always, I'm open to questions, and this is just to reach out to more people, people that I don't know or are friends with through social media. This is just another avenue to advocate for young people, because we don't necessarily share these things that we go through, and sometimes it can be so therapeutic to share what your journey, and it in the end will eventually reach someone that doesn't know or doesn't have that great support system. So I've been very fortunate to like have a lot of people, you know, that support me, people that I know, people that I don't know, and it's what really keeps me going, because it's like, how can I be down on myself when I have so many people that look up to me, so many people that are rooting, and with God we'll get through this. But we're just praying that that bone marrow biopsy, recent one, is still clear, and if not, we'll still treat, like I said, as such, because the ultimate goal is for me to get a bone marrow transplant. And so I guess we'll be talking soon. I hope you guys enjoy. I hope you learn a lot, because it's very, you know, it's a lot of information, and it's always good to keep yourself aware, because you never know. I didn't expect, you know, this to happen to me so soon. You know, you always have that thought, like you see people go through it daily. Like I've met so many people, and so many people have had reoccurrences in this. You know, you always wonder like what makes them so different than you, but everyone has a unique journey. So it's just interesting to follow and see what life has in store for us all. So thanks again for subscribing, and we will talk soon. Bye guys.